So menopause is defined as no menstrual period for 12 months. Perimenopause or menopause, treated in regular medicine or allopathic and alternative medicine, can be used by these type of hormones. So Premarin and Prempro are hormones that come from horse's urine. Those are not bioidentical, okay? Birth control pills, some of them are bioidentical, some of them are not. Bioidentical means that it's the exact molecule of hormone that's supposed to be in your body. So something from a horse is not bioidentical. That should not be in a body. Prometrium is bioidentical progesterone, so it's the exact molecule of progesterone. Natural progesterone creams are bioidentical. Biest is cream-based or topical, like patches, cream, that kind of thing. That's actually bioidentical. Bioidentical meaning it's the exact same molecule. It has to be compounded. It's cream-based, so then it's delivered to the tissues just like your ovaries delivered it to your tissues. And then it's, because it's, what am I trying to say? Oh, it's rhythmically dosed. So it's to mimic the same rhythm that the female had. So several different ways that it's overall very similar to the body. So your body knows what to do with it. So I'll go into that a little bit more here. Natural state of life, then why go on hormones? Well, this will kind of explain. So the life expectancy and age of menopause, as you can see here, the line of menopause is that dotted line that's going across. So in 1850, women used to die before menopause. In the 1900s, we died at menopause. Now in the year 2000, we're living almost 40 to 50 years after menopause. So what is the quality of life? What happens as women start to decline in hormones, and men, is that, like I was saying, you're more prone to insulin resistance. You will also demineralize your bone. So if you don't have good bone structure, what is your quality of life if you're living 40 to 50 years after menopause? Brain starts to deteriorate. What happens is if you have low estrogen to no progesterone, which is what happens in menopause, the brain actually starts to atrophy or starts to shrink. So many different things are occurring once you start going down with your hormones. So this is the rhythm that we repeat when we do our hormones. So it's bioidentical, biomimetic, meaning that it's following the same rhythm of the body. And so these ratios of hormones throughout the female cycle actually will tell the cells what to do. So low estrogen to no progesterone actually is a proliferative state of the cell. This tells the cells to grow. When you peak on day 12, this tells the cells to stop growing. It's actually G1 arrest occurs. And when you peak on your progesterone here to estrogen here, it tells the cells to die off. It's called apoptosis that occurs. So if I were to cover this part of the screen and just have this is what people are in menopause. They're low estrogen to no progesterone. So when you're in this state, you're in a constant state of growth without inhibition. And if you know anything about cancer, this is more pro-cancer state. So when we put these peaks back in line, the cells start listening again. So you don't have cells hanging around. You have death of cells and the new cycle occurring. When you were at your peak, this is what was going on in the body. So when you have estrogen it grows, like example, bone. You grow the bone, you come in with progesterone. Progesterone clips off the old so that you have more room for new to grow. So when you don't have the progesterone piece, what happens in the brain is you have growth, but you don't have the old going away. So actually what happens is your brain starts to shrink. So when you put this back in line, we have seen over a 2-year period of time an increase in bone density up to 35% in our patient population.
What about the brain?
Yes, the brain, it helps the brain. So that's one way of knowing if we're helping physiology, we can see it with the bone density in a 2-year period of time. So then we know that these cues are occurring. So Dr. Ryan has been prescribing bioidentical hormones for over 20 years now. She's tried patches, other creams, static dosing, which is the same dose every day, troches, where they're in their mouth, orally. So a lot of different ways she has tried, but she's never seen an increase in bone density like we've seen with this type of a dosing. So we're pretty close. Well, it's a cream-based estradiol and progesterone, and it's dosed biomimetically. So
like once a week? Or?
It's applied, it's cream, applied twice a day. Which,
twice a day?
Yes. The reason being is because it goes in, so the cell, this is a cell, and the receptor, right, I was talking about, you apply the cream and it sits in the receptor and it clears out fast.
Oh.
That's why you have to apply it 2 times a day. That's actually a benefit, because the Premarin and Prempro, doctors never used to monitor levels because it would sit in the receptor, not perfectly, but it would sit in the receptor and block that receptor for, I don't know, 5 days before half of it was cleared out. So the difference is, when you do bioidentical hormones versus something like Premarin or Prempro, is that this type of dosing is more anti-cancer, right? So there are a lot of benefits to this peaking, those peaks and valleys of this rhythm. And when we put people on hormones, we actually check you on those peak days, day 12. There's 80 years worth of data as far as where to shoot for the ranges. So it's more science-based when we do dosing this way. So low static dosing. Static means the same dose all the time. It's not like what I was just showing you, okay? So there are no peaks. Eventually everything else in the body, including the receptors, start to downregulate. So they stop listening. Those receptors stop listening. So then you have reoccurring symptoms. The level persists at a point that's more stimulatory to the hormone-driven tissues. So you can have relief from symptoms, but eventually over time they can stop listening. So the benefits gained from static dosing are lessened in short term in nature. So benefits of rhythmic dosing, now we're back to that rhythm again, okay? You have an increase in bone density. Like I said, over a 2-year period of time, you've seen an increase up to 35%. Resolution of perimenopausal symptoms, that's pretty fast. The hot flash and vaginal dryness goes away pretty quickly. Headaches, people that are prone to headaches due to fluctuation in hormones can have relief from this type of rhythm. Mood and psyche change, of course, because on that day 12, when your estradiol peaks, that helps upregulate serotonin, actually. Serotonin's a feel-good neurotransmitter. And only if that peak is proper also, in the presence of pure darkness, does serotonin convert to melatonin. So that's why it can also help with sleep patterns as well, too. And then the second half of the cycle, when you're peaking on the day 21, that helps upregulate GABA, which is a natural anti-anxiety. So it can help with that as well. So it helps with the anti-anxiety, anti-depression kind of thing. So it helps with deep restoration of sleep and dreams, reversal of incontinence and dryness, libido, the skin, because as estrogen starts to decline, you actually will start to lose collagen or ability to produce collagen as fast. And then the anti-cancer benefits of those peaks. Hormones and bone density. Rhythmic dosing tells the cells when to grow and when to die, actually will rebuild the bone. We actually have the before and after bone scans of these women with that show reversal of osteoporosis. Static dose hormones, the same dose all the time, only slows down bone degeneration. It doesn't help rebuild it. And then, I don't know if you know, but Merck is facing class action lawsuit over Fosamax. That's a prescription that was used for osteoporosis, osteopenia. Because what it does is Fosamax doesn't actually promote new bone. What it does is it holds on to the old even longer. So that's why you have old, brittle bone, and people were having weird fractures like in their jaws and their large bone here. This shouldn't happen. This shouldn't happen. It's because it was brittle bone that's being held back. So different when you actually are helping rebuilding the bone with the dosing like we do.